researchers at Beaumont Hospital have been busy working on a solution developing a rapid test. And to speak more about that, we want to bring in Dr. Laura Lamb over at Beaumont Health. Thank you for being with us on the Oakland County MegaCast.
Thank you so much for having me here today.
I know we've had you on previously talking a little bit about this, and that was way back in the beginning. Can you tell us about the test and how it works and how you were able to develop it?
Yeah, so we've been working on a test. Unfortunately, it's not available quite yet to the public, but our test would allow you to use a nasal swab or a saliva sample. And we use a new technique called RT LAMP, which basically allows us to make really quick photocopies of the virus so we can detect if the virus is there or not. And then it's kind of like a pregnancy test where we can run it out on a device where one line means you do not have the virus or detectable levels of the virus, and two lines would mean that you're positive for having the virus responsible for COVID-19. Again, this isn't available to the public quite yet, but we're working really, really hard to get it out there quickly.
So many people in the healthcare profession working around the clock to try to come up with vaccines and test everything related to COVID-19. So when do you anticipate that it would be available, and where are you in the process of getting it out to the public?
Yeah, that's a great question. So right now we're in the process of applying for federal funding. This funding would allow us to go through and apply for FDA approval for the test. That's a really important step. That process right now is allowable under what's called emergency use authorization. So it's kind of a fast pass compared to normal FDA approval, since this is a pandemic, and everybody at all levels of research in the government want to make sure that there's good, reliable testing available quickly. And the same thing is going on right now for different treatments. It's kind of hard to tell how long this process can take, because right now, again, we're in the process of applying for funding. It takes a couple months for that to go through the review process and possibly be awarded to us or other tests, and then you would start the process for FDA approval. So that's where we are currently, and we're I promise you we're working really hard on trying to get this done.
Testing has been so confusing for me because we hear so much about all of these various tests. You're hearing about rapid tests on the market now, and then there are other tests about antibodies. And how can you clarify some of that for us? Like, why is there the difference, and what should people really do, and which test should they have to get the most accurate results?
Yeah, so there's two types of main tests. One is going to detect the virus directly. It's only going to look for the virus. That's called molecular testing, or PCR. So that's the gold standard. That's going to be the most sensitive and the most accurate. And unfortunately, that's the test that takes the longest and has to be done in a professional hospital or clinical lab setting. So that's done with a nasal swab or a nasal pharyngeal swab, which is the very uncomfortable swab, I know, but it's going to give you the best results and the most accurate representation of whether or not you have the virus at that particular moment. It's not going to predict whether or not you have the virus in the future or the virus in the past. It's reflective of that moment when you took the test. The other big testing that's out there, and this is what a lot of those tests fall under for rapid testing, is the antigen or the antibody testing. This is serology testing. This is what it's also called. I know, and that's part of the confusion, is all of these things have different names. In general, serology testing is going to be less accurate than molecular or PCR testing. And so if you really want to know whether or not you have had or you currently have the virus, you're going to want to go with a molecular test. If you're asymptomatic and you are maybe just potentially exposed, serology testing is an option. The only thing you have to be aware of is that a negative result with serology testing doesn't necessarily mean a true negative. It's less sensitive. And so for some cases, if you get a negative test, your healthcare provider might recommend you still get a molecular test to confirm that you're truly negative for the virus.
We're speaking with Dr. Laura Lamb, Beaumont Health researcher. How do you even start this process of coming up with a new test?
That's a wonderful question. So it depends on if you want to develop a molecular test or a serology test. With the molecular test, we need to know what's the bad guy, what's the pathogen. In this case, we know it's coronavirus, and we need to know the nucleic sequence. So what's the sequence of nucleotides or DNA, or in this case RNA, that makes up that virus. Once we know that RNA sequence, we can go in and design things that will specifically pull out a section of that virus. So that's why it's a very, very specific test. And that's why it's very sensitive, because you're directly measuring the virus itself. With serology testing, we're actually looking at the body's immune response, and to see if the body has seen the virus. So it's kind of an indirect test. And that's why it's a little bit less sensitive, because we're not looking for the virus itself. We're looking for whether or not the body has been exposed and potentially sees the virus. And in some of the antigen testing, we're actually looking for proteins that would be expressed on the outside of the protein. On the outside of the virus. So it's a little bit less sensitive. It's a little bit less accurate, and but it's a good option for cheap, inexpensive testing. You just got to be careful of those what we would call a false negative. So that's somebody that has the virus, but they got a negative result. And so for those type of tests, we either have to wait till we get people that develop immune responses so we can see what type of immune response we can measure in the people, or we have to grow lots and lots of virus and figure out what those proteins are on the outside of the virus in order to develop antigen testing for that.
Dr. Laura Lamb with us on the Oakland County MegaCast. She is a researcher from Beaumont Health with us on the program today. Dr. Lamb, in developing those two different types of tests, which one is more tricky to develop? Because you said one's a little less accurate and allows for a little more rapid testing. The other one's a little bit more accurate and is often more effective. Which one presents more challenges in the development?
They both have their own unique challenges. The molecular tests were the first ones that were being used in the clinic, and the first ones to get FDA approval. The serology tests are what we've been seeing coming out more recently, especially the antigen testing. I will say that some of especially the antibody tests, so again, this is measuring your immune response to the virus, whether or not you've been exposed to the virus in the past. Some of the tests that were originally FDA approved under this emergency use authorization have had that removed. They no longer have FDA approval because they ended up not being sensitive and specific enough. So again, molecular testing, if you really, really want to know if you truly have the virus at the time, is the gold standard for testing right now. Unfortunately, that gold standard for testing takes a lot of reagents and a lot of really trained personnel, and that's why you're having this delay in response. I know several people that have had to go get testing, and I know it's very, very frustrating waiting those couple of days to get a test result, and that's why we're trying to work on developing molecular tests that are fast and don't have a several-day wait period.
This testing, if it reaches the mass market, could really be a game changer, because you think of all the revenue lost for businesses, employees sitting out, things of that nature. If you get the funding and it comes to mass market, would it keep the cost down? Can you talk a little bit about that?
Yeah, so one of the things that we really like about the technique that we're using is, one, it's a molecular test, so it's going to have that sensitivity that we really, really want. But the reagents are a little bit less expensive than the test that's out there right now. And the time that it uses is a lot less. And lastly, it doesn't require an expensive machine to run. Right now, your PCR test, the molecular test that's being done, requires a machine that's about the size of a printer and the price of a new car. We don't require that for our new test. That's why we think that it can really help keep the price of tests down. And because of that, we really do need a fast, cheap test for reopening of businesses and schools. And local economies, because it's not that people need to be tested once. They're probably going to have multiple exposures as we reopen. And so they're going to need to have the availability to have repeat testing.
Yeah, I think people forget when you get tested, it's just that snapshot and that moment of time. You could go somewhere after you take the test and pick up the virus there. During this pandemic, one thing we've seen from the healthcare industry is how healthcare workers across the globe have been coming together, sharing their research and their information to try to tackle COVID-19 as a team. Can you talk to that? Has your team been involved in reaching out to the healthcare industry and researchers across the world? And have you shared your research?
Yes, it's really been amazing how rapidly the global scientific and medical community came together to share resources. Um, so I talked in the beginning, for developing a molecular test, we need to know the sequence that makes up that virus or bacteria. That information was out there and available early January of this year, which was absolutely amazing that people were rapidly putting that information out there, because it's not only useful to researchers like me that are developing diagnostic tests, but it's also really helpful for the people that are trying to understand, how does this virus work? Why does it make certain people more sick than other people? How does it get in the body? Because if we understand those things, that's how we can develop therapies for this that are specific for this disease, and maybe even prevention strategies, or understand why, maybe it targets older people more so than younger people, or certain demographic groups other than other groups. So all that information became available. We actually made the recipe for doing this test publicly available and freely available to the world in late February of this year. And so we've actually been in communication with researchers from Europe, Africa, Asia, South America, Central America, the United States, Canada, all over the place. And there's researchers out there that are using this type of test, or tests very similar to it, for research purposes, to understand which populations are getting sick, and maybe using it in situations where they don't have maybe the same medical resources that we're fortunate enough to have here in the United States. So it's been amazing. We've definitely shared this through virtual meetings, and gotten feedback from other research groups. And one of the other fantastic things about this global network of sharing is other groups from around the world that have tried this test have come back to us without us even knowing that they were using this type of method, and told us that it works in their hands and their setup under their conditions. So whenever you have this external validation, it's a very rewarding thing. It really strengthens that this is something that could work.
Dr. Laura Lamb with us. She's a researcher at Beaumont Health, with us on the Oakland County MegaCast across the local area. Dr. Lamb, earlier you talked about the training, that it takes more training and more expertise for the current gold standard testing in order for that to be developed and for that to be processed. For your new test, what kind of training would go into that on the medical side to be able to process those? Would it require similar training to the current test under the gold standard, or would that require less training and make that even more so efficient?
That's a wonderful question. And to be quite honest, I'm not quite sure if we get a final product made and FDA approved, 100% what that answer would be. The nice thing is, it does not necessarily require a high technology hospital laboratory to run. It could be done in much more simpler conditions. And it definitely does not require a PhD in biochemistry to be able to run this test. I could train somebody that is able to follow simple directions to be able to run it. The FDA, however, has very stringent regulations on what can be done by who under what settings. And so we're going to have to follow their guidelines. And that's kind of the best I can say. We will do everything we can to make it most available to most people, because this is something that is very simple and most people could probably figure out how to run, especially if they were trained. But we're going to follow FDA guidance, because that's the rule of the law, and there's reasons those rules are in place.
Are you concerned because the FDA's rules are maybe stricter than in other countries that another company or someone else could develop this before you get a chance to get it to market?
I think that the current pandemic, we need multiple testing solutions out there. And so if another company comes to market before us, then that's the case. I'm not going to feel like I necessarily have to be the driver in this case. I would love to be along for the ride because I've worked so hard on this and our team's worked so hard on this, but we need testing solutions now.
And those testing solutions, like when you say we need them now, we so need them now. We needed them in March. We needed them in April. What's next? Where do things stand right now for you and your team?
So as I mentioned, we're applying for federal funding. Keep your fingers crossed that we're fortunate enough to receive it because that will allow this, to really take off and move forward. We're also working with other research teams nationally and globally, not only on diagnostic testing, but also really understanding, what populations are more susceptible to getting this virus and getting truly, really sick from it. So not just, you stay at home, you quarantine for a couple days, but the people that are going to unfortunately require hospitalization and maybe even ventilators and so forth. So we have other projects that we're working really hard on. There's some other fantastic teams here at Beaumont, and I know also regionally at U of M and Henry Ford and DMC, and no one hate me if I didn't include your group, but there is some fantastic work that's going on. And again, want to re-emphasize to your viewers that this is something that we're working really, really hard on, and we appreciate your support.
I know you have applied for federal funding. Is there a possibility of a private company or of a private entity providing funding for something like this as well?
If someone is willing to do philanthropy through an individual or organization, please reach out to the Beaumont Health Foundation, and they will definitely help facilitate that to help support this research, and we would definitely appreciate it.
Dr. Laura Lamb with us on the Oakland County MegaCast. She is a researcher at Beaumont Health, and they are currently working on a rapid COVID-19 test. They're awaiting hopefully some federal funding to be able to get that test through the FDA process of FDA approval and hopefully get that test out to the public relatively soon. Dr. Laura Lamb, anything else that you'd like to speak about in terms of this test and the process, the stage in the process of getting the FDA approval down the line that this test is in?
I just want to say thank you once again, and we're very excited about being able to help contribute to this pandemic in one way or the other. So thank you again.
So Dr. Lamb, I have a personal question kind of for you. What's it been like for you to work on something like this that could be such a game changer for the entire country and the entire world?
Our normal routine for our group is we actually study benign bladder disorders, so diseases that either cause a lot of pelvic pain or maybe result in individuals becoming incontinent. And so we actually work for developing diagnostics. So it's been really rewarding that we could pivot so quickly from what we do normally to very early in this pandemic, being able to develop something that could be helpful to the global community. It's definitely something that we're all putting, lots of hours into, and it's been, to be honest, maybe a little frustrating at times because I feel like we have a solution and maybe we're not able to get the right people to see it or get the right resources in line. But that's part of the process. Science doesn't happen overnight. And yet right now with the circumstances, everybody's trying to do things as quickly as possible without sacrificing quality. Because if you get something that doesn't work to market, you not only waste a lot of people's times and resources, but you also lose that faith of the public in science and in medicine. And that's something that is very valuable. We don't want to ruin that trust. So that's why, as burdensome as some of these regulations are, it's really important that we follow the guidelines so that we don't somehow betray that trust.
I know that typically, is it something like this would be years in the making? So when did you start it? And then to have it this far along at such a short amount of time is somewhat of a miracle in itself, right?
You're absolutely right. So we actually kind of got involved in doing another infectious disease caused by a virus a couple of years ago. So I'm sure you've heard of Zika virus. We used this same method for Zika virus a couple of years ago. And the whole process from us taking, knowing the sequence, developing the test, and sharing it with the larger scientific and medical community took like a year and a half, 2 years. And for us, when Corona came out, because we had that previous experience and we were so eager to really help, we were able to kind of condense that process down to 6 to 12 weeks. It was really amazing. So we really benefited from previous experience. And again, because this was such a short, get it out the door type of thing, seeing that other groups throughout the whole world have been able to validate what we've observed has been really great, because it really says that even though we did this in a shorter time frame, other groups can still do it. Other groups see the same thing. So it really validates our initial findings.
Dr. Laura Lamb, one of our true heroes right here in our own backyard. A huge thank you and shout out to you and your team and all the time and effort that you're putting into this project to help all of us. It really is an honor to have you right here in Oakland County. So thank you for all your hard work.
You're much too kind. Thank you so much for having me. And hopefully we can all get some cider at the Franklin Mill soon.
I know they open September 5th, so mark your calendar.
I know, I'm so excited.
It really is the little things back in the middle of this pandemic, right?
Yep. Everybody wear your mask and wash your hands and we should be good.
Thank you so much. Dr. Laura Lamb, researcher over at Beaumont Health, joining us on the Oakland County MegaCast.